Entonces, resumiendo, las indicaciones de una fórmula hidrolizada de estos pacientes podría ser pacientes que tengan alteración de la dilución o de la absorción que limiten la absorción de las proteínas, enteropatía perdedora de proteínas de cualquier causa, pacientes críticos con dismotilidad, pacientes con alimentación transpilórica, sea duodenal o yeyunal, y pacientes que ya se alimenten con forma hidrolizada o que tengamos sospecha de sensibilidad a la proteína entera. La dieta cetogénica, como conclusiones, es una terapia médica nutricional efectiva para la mayoría de los pacientes que la utilizan. Pero hay pacientes que siguen siendo un desafío el usar esta terapia, especialmente aquellos que tienen historias clínicas muy complejas. Las fórmulas a base de péptidos pueden ser un recurso temporal o permanente útil para evitar la discontinuación de esta terapia en pacientes lábiles, gastrointestinalmente hablando, en estado crítico o en momentos de estrés o intercurrencias. Como recomendaciones les dejo que la elección de las fórmulas cetogénicas deberá tener en cuenta el estado nutricional previo, la función gastrointestinal y la tolerancia del paciente. La nutrición terapéutica avanza poniendo foco en el paciente, hace una nutrición absolutamente personalizada. Y obviamente el manejo interdisciplinario es crucial para el éxito de este tratamiento. Bueno, agradezco a mi equipo y mi servicio porque me ayudó a armar la charla y les dejo mis referencias también.
Hi, can you see my screen? Can you see my screen?
Yes, we can see your screen perfectly well.
Okay, great. Well, thank you to Laura and Dr. Armino for sharing your ketogenic experiences. My name is Rebecca Jennings, and I am a dietitian clinical specialist with Ajinomoto Cambrook. And I'm going to share with you today the nutrient breakdown of Ketovie Peptide and Ketovie 3-to-1. We'll start with Ketovie Peptide. First, know that peptide-based formulas have been on the market for over 70 years. They're often used to treat symptoms such as reflux, cow milk or soy protein allergy, atopic dermatitis, or GI disorders. There's some evidence that peptide-based formulas are better tolerated and better absorbed than free amino acid-based formulas. And because peptide-based formulas have specific indications, dosages, and lengths of therapy, it meets the definition to be called a medical food. Peptides are broken down proteins, and the smaller the pieces, the easier they are to absorb in the GI tract. These peptide pieces are measured in Daltons, which refers to the molecular weight of the protein fragment. And the smaller the Dalton size, the more hypoallergenic the protein. This is a visual of the different stages of protein breakdown. We start with intact or standard protein formulas. We have some examples of these infant and pediatric adult formulas up here, and this is where you would find your regular Ketovie 4-to-1. We next go down to a partially hydrolyzed base protein. Again, we have some infant formula examples up on the screen. And this is where we're going to classify Ketovie 4-to-1 peptide. You can break the protein down further into extensively hydrolyzed protein. And this is usually defined where 95% of the protein fragments are less than 1,000 Dalton size. You can see some infant formula examples, and there really are no pediatric or adult formula examples of this category. And finally, you can take it all the way down to free amino acid-based proteins. And again, we have some infant formula examples up there and their junior counterparts. Prior to Ketovie Peptide, there was no other nutritionally complete formula option for patients who do not tolerate intact proteins. What the practitioner would end up having to do is to come up with either a home blenderized formula or to concoct an amino acid blend. There are some specific challenges to these two options. First, for blenderized formulas, you had to rely on consumer knowledge in choosing appropriate foods. There's nutrient inconsistency from food to food, but also from season to season. There can be issues with delivery, such as with frequent tube clogging, and you're unable to utilize a feeding pump for continuous infusion. It requires a high quality blender, which can often be quite expensive. There's food safety issues since the final blend cannot be pasteurized. There's the added time for preparation, but also by calculation by the clinician. There's a high risk of mixing error, need for additional vitamin and mineral supplementation, and separation of the blend if an added emulsifier is not used. And then for amino acid based formulations that you are having to piece together in order to create a ketogenic amino acid formula, you're going to be dealing with formulas that are often quite high in osmolality, and this will translate into issues with tolerance. There's also the inconvenience of having to come up with a cocktail approach of adding several different modulars together. There's an added cost to this approach. And then similarly to the blenderized mixes, you're going to be dealing with food safety issues because the final mix is not pasteurized. There's a high risk of mixing error, the added time, the added supplements, and again, separation if adequate emulsifiers are not used. So who's appropriate for a peptide-based formula? And Dr. Armino did cover some of this in her presentation. But patients who have intolerance to whole or intact proteins, and this may translate into symptoms such as reflux or diarrhea. Also, patients with dysmotility. Movement disorders affect not only the limbs, but also the GI tract. And peptides can move out of the stomach faster than whole intact proteins can. Also, patients with malabsorptive conditions, as fewer digestive enzymes are needed to break down the smaller peptide fragments. And those receiving post-pyloric feeds, either duodenal or jejunal feedings. This requires continuous feeds as you're bypassing the stomach. These feeding modalities often bypass the gallbladder and pancreas, which obviously have important digestive functions. And you're infusing the formula in a location in the gut where it's already prepared to be absorbing peptides. Specifically for the ketogenic population, they're often dealing with mobility issues, and decreased mobility will reduce the tone of the GI tract. Also, peristalsis in the GI tract is a nerve function, so those with neurological impairment often also have impairment of their GI tract. Also, decreased tone of the lower esophageal sphincter, which can lead to increased GERD symptoms. And then GERD can also lead to increased aspiration pneumonias. And in the case of the ketogenic diet, that's a concern for lipid aspiration pneumonia. And GERD can lead to volume intolerance. And then again, feeds that occur post-pylorically, you're reducing exposure of the formula to digestive enzymes, and there's a shortened region for absorption. So getting into the specifics of Ketovie Peptide, what stays the same between Ketovie Peptide and our standard Ketovie 4:1 formula? They both come in an 8.5 ounce Tetra Pak at a 1.5 kcal per ml caloric density. They both contain added DHA, also selenium for cardiovascular health and carnitine for fatty acid oxidation. There's a bone health blend of vitamins and minerals, and it comes in a 4:1 ketogenic ratio. How is Ketovie peptide different from our standard Ketovie 4:1? Well, of course, the protein source is different. We utilize 100% hydrolyzed whey-based protein. Both formulas contain MCT. However, we've lowered the amount of MCT in the peptide down to 14% of total calories. This is because we assume we're dealing with a GI-sensitive population. The amount of carbohydrate is slightly different at 1.4 grams of total carb per 100 mLs in peptide, or 0.4 grams of net carbohydrate. We also reduce the fiber amount. It's 1 gram per 100 mLs, and this is again because of the GI sensitive population. And the sweetener used in the peptide is stevia to make the formula palatable for oral feeders. One question we are often asked is Ketovie peptide 4:1 safe for those with milk allergies? And just to put a definition to that, food allergy is a reproducible reaction of an immune system function induced by a specific protein found in food. Symptoms of IgE-mediated allergies include irritability, failure to thrive, reflux, vomiting, diarrhea, constipation, bloody stools, eczema, nasal congestion, wheezing, coughing, stridor, hypotension, shock, and anaphylaxis. Patients who have a documented IgE-mediated food allergy to milk should not be changed to Ketovie peptide as it has not been tested in an allergenic population. Overall, Ketovie peptide is a 4:1 ketogenic ratio. It is nutritionally complete and ready to feed. It contains 100% of hydrolyzed whey as its protein source with small Dalton size. It contains 14% of the total calories from MCT. It contains omega-3 fatty acids and DHA, and it's supplemented with carnitine for optimal fatty acid metabolism. Under carbohydrates, we've lowered the fiber. It is aspartame-free and in fact uses stevia. It's low lactose and low in net carbohydrates. It has an enhanced vitamin and mineral content for bone health and contains potassium and sodium citrates to help buffer and prevent acidosis. And when Ketovie peptide was first launched in the US, we collected some data on some early experienced patients so we could ascertain the tolerance to Ketovie peptide and also efficacy. We divided these patients into those who were new to ketogenic therapy and then those who were switching from one ketogenic regimen onto Ketovie peptide. So we start here with those who are new to ketogenic therapy. We had a 1-year-old who was receiving at baseline Ellacare Jr. amino acid based formula via G-tube. They were referred to Ketovie peptide due to intolerance to intact protein and history of hydrolyzed formula use. He was transitioned onto peptide and tolerated it quite well, and he was also mostly seizure-free. Next, we have a 13-year-old female who is receiving a regular diet during the day and feeds a Peptamen Jr. overnight through a GJ tube. This patient had a history of gastroparesis. They did do a brief trial with our regular Ketovie plus MCT, and she was having diarrhea when she was trialing that mixture. So they decided to go with the Ketovie peptide. When they made that switch, the diarrhea and gastroparesis symptoms resolved. And once fully initiated onto the ketogenic diet, this patient was also mostly seizure-free. And next we have a 17-month-old male who at baseline was receiving Pediasure peptide via G-tube. They were referred to Ketovie peptide due to a supposed milk protein allergy, though it likely was not a true IgE-mediated allergy, as the Pediasure peptide is also not considered a hypoallergenic formula. They transitioned onto Ketovie peptide just fine and is also mostly seizure-free. Next, we're going to look at those who were transitioned from one ketogenic regimen onto Ketovie peptide. First, we'll look at a 3-year-old male who is receiving a mixture of KetoCal plus MCT to a 4.5-to-1 ratio. They were referred to Ketovie Peptide due to delayed gastric emptying, gagging, gas, constipation, and a possible re-flare-up of eosinophilic esophagitis. Upon making the switch, gas resolved and the patient was having daily bowel movements. They maintained their current level of seizure control, and they elected to continue with the Ketovie Peptide. Next, we have a 5-year-old